Hello, and welcome to our webinar, Falls Prevention in Emergency Services. My name is Michelle Bertrand. I'm a community educator, registered nurse, and lead for the Caregiver Education Program at the Mississauga-Halton Regional Learning Center. During this presentation, I will discuss a number of things that you can do as a caregiver to reduce the risk of falls in the home setting and ensure the safety of your care receiver. We know that medical conditions increase the risk of falls, and while there isn't much that can be done to change the diagnosis and health challenges of the people you are caring for, there are some things that you can do to decrease the chance of falls at home. Note that as we support individuals living in the Mississauga-Halton region, many of the resources discussed will be based in this area. However, much of the information around falls is applicable wherever you reside. Before we get started, let's review some myths versus facts around falls. Think about these statements. Are they a myth or a fact? Falling is a normal part of aging. If you limit your activity, you won't fall. Taking medication does not increase fall risk. Using a walker or cane will make you more dependent. If you said all of these statements were myths, you would be correct. Falling is not a normal part of aging. There are natural changes that occur as we get older that can increase our risk, but falling is not normal for us as we get older. If you limit your activity, you won't fall. This is also a myth. Some people believe that the best way to prevent falls is to stay at home and limit activity, especially those individuals who have already experienced a fall. Not true. Performing physical activities will actually help to maintain independence, as strength and range of motion both benefit from remaining active. Social activities are also good for your overall health. When it comes to medications, taking any medication may increase fall risk. Medications affect people in many different ways, and falls can unfortunately be a result of side effects. Using a walker or a cane will make you more dependent. Absolute myth. The reality, walking aids are very important in helping many older adults maintain or improve their mobility and can actually increase independence. Let's define what a fall is. A fall is an event that results in a person coming to rest inadvertently on the ground, floor, or other lower level with or without injury. This is a description by the World Health Organization. It is also important to understand what a near fall is. A near fall is an event in which a person feels a fall is imminent, but avoids it by compensatory action, such as grabbing a nearby object or controlling the fall. Near falls can signal or warn us that an individual is at risk of falling and can help prevent a future fall. Find out from the individual why they almost fell and what happened so that action can be taken. Was it due to a medication they took? Are their shoes ill-fitted? Are there cords or carpet underfoot? Maybe there are things to be changed or improved that can reduce their risk. That's why understanding a near fall can be helpful. These are some statistics on falls and shed a light on why they are important to understand and prevent. Falls are the #1 reason for injury-related death, hospitalization, and emergency department visits for older adults in Canada. Falls among older adults cost $6.5 billion in 2018, nearly 20% of the total cost of injury in Canada. We can see from this infographic that as age increases, so does the risk. If you are over 65, you have a 1 in 3 chance of falling. After age 80, this increases to 50%. 95% of hip fractures are a result of a fall, and 40% of nursing home residents are there ultimately because of a fall. Over 1/2 of visits to the emergency room by a senior due to an injury sustained in a fall will result in hospitalization lasting more than 3 weeks. So this is why falls and falls prevention really needs to be an important part of health planning and health decisions. Some other important facts about falls in seniors include the fact that if you fall once, you are more likely to fall again, especially if the cause for the fall is not determined or addressed. Women are 3 times more likely than men to be hospitalized for a fall. However, men are more likely to die from a fall. This may be related to the fact that men are more physically active or more likely to engage in risky behaviors or tasks such as cleaning out the leaves from the eavesdrops or shoveling snow, which increases risk. Despite these facts, it is important to remember that falls are not a normal part of aging. So we can see why falls are so important in terms of prevention and its impacts on the healthcare system. However, in addition to the facts and statistics that I just mentioned, there are other things that can happen after a fall, even if no injury is sustained. Firstly, some people lose their confidence in their ability to get out and about. They may also become afraid that they'll fall again, which results in them not going out and doing things they enjoy. This results in isolation and less engagement in physical activity. Remember the saying, use it or lose it? That applies here. Less physical activity can contribute to a decrease in mobility and overall health. I want you to reflect on your experience. Has this loss of confidence, feeling afraid, not wanting to go out, happened to you or your care partner after a fall? Think about how this loss of confidence and fear affected your life and or the life of the person you are caring for. Okay? It can have a real decline in the quality of life. Another important impact to consider is the less someone does, the weaker their muscles become, the poorer their balance becomes, which increases their chances of falling again. As you can probably guess, this has a direct effect on caregivers and family members, as the person who fell becomes less independent and less mobile. They now require more care and support. This can increase the time, money, and effort that is required to provide caregiving to the individual. So over the past few slides, we can see the many impacts of falls outside of the physical injury. Let's move on and discuss why people fall. If we look at this cartoon, it's pretty obvious why this person is falling, but it reminds us to be aware that falls don't just happen. There are usually some contributing factors to a fall, and if we can identify those factors, changes can possibly be made to reduce the chance of a fall occurring again. People fall for a variety of reasons, and these reasons are called risk factors. If we look at the pieces of this puzzle, you'll see that many of those reasons or factors are related to health conditions. However, we know that risk factors for falls are numerous, complex, and interrelated. Medical conditions, vision, symptoms like dizziness, blood pressure, leg strength and balance, even depression can increase fall risk. Medications and their side effects can cause blood pressure to drop, resulting in dizziness. Medications that control blood sugar can also drop glucose blood sugar levels and cause people to feel dizzy and fall as well. Reduced alertness and response time can be a result of medications for mood, anxiety, depression, and can increase fall risk. Poor nutrition leads to inadequate fuel and support for the body. We know the cost of food is high these days. Consider what healthy foods you or your care partner may be able to afford. Are they eating enough? Again, low blood sugar can result from inadequate intake as well, which can be a life-threatening condition. Home safety is a big one. The presence of carpets, clutter, cords, poor lighting, uneven stairs are hazards that can lead to falls. Risk-taking. This is a result of the behaviors and choices that the individual may engage in that may cause a fall, including actions like drinking, skipping medications, or participating in activities that may not be safe for them based on their physical or cognitive abilities. The more of these risk factors that a person has, the more likely they are to have a fall. If someone has no risk factors, the risk of falling is about 8%. If they have 4 risk factors, that risk jumps to 78%. So another important piece of fall prevention is to know your risk factors and the actions that can be taken to prevent a fall from happening. Some risk factors can be changed, altering footwear, making changes to increase the safety of the home, or perhaps taking steps to improve nutrition. Some of them are not cannot be changed. These are what we call unmodifiable, such as your age, some medical conditions, and necessary medications. So we've talked about what a fall is, the factors that can lead to a fall, risk factors, and some of the stats. Let's move on and talk about what you can do. Let's focus on the things that we can change. First, you can start with getting a regular medical exam with your care receiver's healthcare provider. At this appointment, discuss how often they should be seen, what regular testing and follow-ups are necessary to manage their health condition or conditions. If there's blood work that needs to be done regularly, make sure that is completed and follow up on the right intervals. Consider whether virtual or phone appointments are sufficient, or if an in-person visit is what you need to get your answers. Oftentimes, face-to-face is best and allows for a better assessment and understanding. If new or worsening symptoms occur and you're not sure what the issue is, things such as dizziness or new onset weakness, be sure to have this investigated as soon as possible. It's important to detect health problems and changes early. Another step that you can take to reduce the chance of falls is to complete the Staying Independent checklist with your care partner. This is an easy-to-do checklist that they can fill out themselves or with your help if needed. To complete, move through the list of questions and answer yes or no for each. Once completed, add up all the totals, 1 for all the yes answers and 0 for no. A final score of 4 or more on the checklist indicates the need for an appointment with your healthcare provider or family doctor to review and find some solutions. Together, you can review and identify the risk. Also, remember to report any falls or near falls to your health provider or any care staff from their nursing home or retirement home or wherever they may reside. Discussing your fall can help identify why someone might be falling and what can be done to help. It's all about prevention. A really important part of reducing fall risk is keeping active with regular physical activity. I've sort of touched on this several times across many of the slides already, and it just proves how important physical activity is to our overall health. There isn't much that really can't be improved by regular exercise, no matter the level of intensity. It's all a positive, it all has a positive benefit. So why are we always encouraging physical activity? Being active keeps bones and muscles healthy and strong and improves your balance. It keeps your heart and lungs healthy and reduces the risk of chronic disease, such as heart disease and high blood pressure. Energy increases, sleep improves. It reduces the fear of falling. People may feel more confident. Mentally, it improves our mood, our memory, and our attention. Okay, and maintaining strength and balance allows for better functional mobility. For getting out of bed, chairs, the car, climbing stairs, getting dressed, toileting, all of those things that allow us to perform our own personal care. And it helps to maintain overall independence. I do understand that people will have conditions that may limit their physical activity, sometimes quite a bit, but every little bit helps. Even if it's chair exercises like in this video or in this photo. If your care receiver is in the early stages of their illness, try to keep them as active as they can for as long as they can. If you're concerned about injuries or if your care partner has arthritis or a heart condition, talk to your healthcare provider as well about activities that are good for them. I will provide some information on falls prevention programs and exercise programs later in the session. The goal of exercise is about 150 minutes of moderate to vigorous aerobic physical activity per week to achieve health benefits. I mention this as just a goal. We know that this is not always realistic for your care receiver, but again, whatever they're able to do should be encouraged as long as they're cleared by their physician or specialist. Try to include strength and balance activities about twice a week. Another thing we can do is review medications. As we age, our health needs may change, and it may take more than our one medication or supplement to stay healthy. It's important to review medications with your doctor or pharmacist. Think about how many medications your care receiver is currently taking. Do you both know the reason for each of the medications, their possible side effects or interactions? Most seniors in Canada are taking at least 5 medications. As the likelihood of having a medical condition increases with age, so does medication use. More than 40% of Canadians aged 85 and older are taking more than 10 different drugs or medications. The amount, type, duration, and doses of medications taken can increase the risk of falling. As I mentioned earlier, medications that help people relax or help you sleep or improve mood are some pretty common ones that can increase fall risk. Also, as we age, the way some medications work and or are handled by the body can change. Some of these changes may also increase fall risk. So these facts support why it's so important to properly manage medications and have them reviewed regularly. To make the most out of your medication review, ask these questions. There may be others that you're curious about, but these are a good start. What is this medication used for? A lot of people have forgotten why they're on a particular medication or don't understand why they're taking it. Will it cause dizziness or drowsiness as a side effect? Blurred vision or double vision? These are all things that contribute to a fall. What should I do if I miss a dose or experience side effects? Would it be safe to take 2 doses close together, or are you supposed to wait until the next dose? What are some possible side effects that could be experienced that I should be concerned about, and what should I do? These are all pretty standard questions to ask about medications and will help you to have a really good understanding about how it works and what the risks might be and how it might contribute to a fall. These are some other things you can do to help generally manage your medication. Keep an up-to-date list of your medications with you at home in case of an emergency. You can get a printout from your pharmacist. They should have a list of all your current medications if you're going to the same pharmacist all the time. This is really important. This helps the pharmacist keep track of everything and keeps all your current and past prescriptions all in one record in one place. It also helps to facilitate identifying possible drug interactions and helps if you need to get an accurate printout and record of current or past medications. As we age, our body also does not break down alcohol as efficiently as it used to, so it's best to minimize the use of alcohol, as even a small amount can increase the risk of falling. The combination of having a little drink at night and then having medication such as a sleeping pill is particularly risky and can increase fall risk. If you're unsure about whether or not it's safe to drink alcohol or smoke cannabis or take cannabis in any form with your prescribed or over-the-counter medications, speak to your doctor, pharmacist, or any other specialist that might be involved in your care. When we looked at those puzzle pieces, we looked at a lot of different risk factors, okay? And one thing that can increase our risk and occurs over time is changes in our vision. The development of cataracts, which is a change in the clarity in the lens of the eye, is common with aging. This is how someone's vision can be impaired when they have cataracts that have reached an advanced stage. This is the same hallway, one with normal healthy vision and one with dense cataract impaired vision. Okay. So in addition to developing disease of the eye, vision can also change in other ways. As we get older, we become more sensitive to glare. We also need more light at night to see. People who are 60 need 10 times more light to see than when they were a teenager. It takes our eyes longer to adjust to certain changes, and it becomes harder to judge distance and depth. We need this depth perception when we are going up and down stairs and curbs, or when there's changes in the ground that we're walking on. That's why it's so important to have your vision checked annually for conditions such as cataracts, macular degeneration, and retinopathy. This is a condition that's common in individuals with diabetes. People that have bifocals or multifocals with 2 or 3 different vision fields in their lenses, okay, can struggle when sort of the fields change. They may not get clear vision. So you have to be careful on those stairs and curbs. You may need to tip your head up and down and look out the top of the glasses to see better. Maybe it's safer to not wear these glasses when going up and down stairs. Remember to clean your glasses frequently and get the prescription changed if necessary during those annual checkups. Believe it or not, issues with hearing can also lead to falls. So make sure to have your hearing checked frequently as well. Talk to your healthcare provider about any changes that you've noticed in your hearing. Protect your ears from loud noises. Researchers have found that people with hearing loss can be 3 times more likely to fall. One reason might be that people with hearing loss have less environmental awareness. They don't notice things happening near them or around them, such as a person behind them or a pet that's underfoot, and it's easier for them to trip and fall. Some researchers have also suggested that people with hearing loss need to use more of their mental resources to hear and interpret speech and other sounds, so they have less mental energy left for other tasks, such as balance. Things like gait and balance are things that we really do take for granted, but they're actually quite cognitively demanding. So there may be a bigger cognitive load on that individual, so they have less resources available to help with that balance and gait and walking. So a fall may be more likely to happen. Another time that falls can happen is when rushing to the washroom. If your care receiver has episodes of incontinence that are causing them to have to run to the washroom, particularly if their mobility is decreased, a fall is more likely to occur as well. Consider a referral to a continence program. This will provide some ways to manage or improve their situation. Trillium Health Partners in Mississauga has a regional continence program that can help with consultation and treatment and or management options. Referral is required, and this can be from a physician or from Ontario Health at Home, formerly called the LHIN. For those of you outside of the Mississauga-Halton area, you can contact your local Ontario Health at Home branch, and they will be able to assist you from there in finding some programs in your local area. Walking aids can be a big help when things start to change in terms of mobility, again, balance and gait. Ask yourself the following questions. Is the person you're caring for doing things like holding on to furniture or walls for support? Have you noticed that they're having trouble stepping up to a curb? Are there concerns about balance? Do they have leg pain that affects walking? If the answer to one or more of these questions is yes, it might be time to consider the use of a walking aid to help mobility. Walking or gait aids include canes, walkers, wheelchairs, and scooters. They're used for mobility and stability. All right, so something like a cane would be good for light stability. A walker would also be used for safety and also to reduce fall risk. It can also improve or enhance endurance. If someone has to walk without a walker, they might be able to do that, but maybe they can only walk one block, versus if they now use a walker, they can walk for longer or stay out for longer. Walking or gait aids can help to reduce pain by taking the weight off of a painful joint, such as a hip or a knee. If someone has a limp, it can make for a smoother step pattern, and that can reduce strain on the other joints. A good physiotherapist assessment is recommended to make sure that you have the right aid that fits, and also the individual gets the proper education on how to best use it. There are canes that have certain shapes, tips, sizes. There may be a certain type of walker that would be better than others for your care receiver, and a physiotherapist will be able to make those determinations. I mentioned footwear in that puzzle that we looked at earlier. Well-fitting shoes that are supportive can increase stability. They can increase comfort and reduce pain. They provide protection, particularly when we think about people who have diabetes. Maintaining the health of the feet is particularly important in these individuals. They provide shock absorption and support for all of the lower body joints, and they, of course, reduce slipping, which can can help to improve overall risk of falls. A good pair of slippers to use in the home is better than stocking feet, as we know that certain flooring, many people have tiles or hardwood, okay? And we know that stocking or sock feet can increase the risk of falling as well. So these are some components of an ideal shoe. Even a slipper would be really good to have these features as well. Okay, so a heel height, not too high, 1/4 of an inch to 1 inch, a rounded heel with width to give more contact with the ground, larger surface area provides more support. The back of the shoe should cover the heel. This provides support and prevents slipping. So things with an open back or slippers with an open back are really not recommended. We want a good grip on the sole and a nice deep and wide toe box to allow toes to be able to move. So it provides for comfort and good circulation. Shoe length, okay, about 1/4 of an inch longer than your longest toe. We don't want them too tight. And laces or Velcro closure allows for a snug fit and will permit any swelling to happen, as we know that some people have medical conditions where this is something that they do experience. It may be a little bit more difficult. Individuals might need some help in doing up laces or Velcro, and slip-ins might seem easier in those instances and make them more independent, but it doesn't allow for the space or adjustment in the shoe that we might need when someone has swelling or edema. Something to think about. If we look at these photos, okay, what's wrong, right? These individuals are not paying attention, perhaps trying to multitask. This gentleman looks like he's carrying coffee. This one's talking on the phone and carrying groceries, okay? So this can increase the risk of falls as well. So when you're walking, we want to pay full attention to our surroundings. particularly when we're in unfamiliar settings. Okay, this is going to help, again, reduce our fall risk. And this is good advice for anyone. When we're walking in the winter, of course, there's ice, snow. Sometimes we don't even recognize there's a thin layer of ice, and we can go down quite quickly. So we want to watch for hazards, particularly in the winter time. Sometimes snow, there's a little layer of snow, excuse me, that's covering ice. Watch for black ice as well. Keeping the walkways clear of snow, of course, is important, but can be challenging for people that have disability, excuse me, or are living on their own, and maybe they're a senior and they don't have the physical capability to clear their walkways. So there are some programs that may help. There are many people offering snow services that can be found on social media, things like the Nextdoor app. Be diligent, check your sources. Best to have a referral from someone who has maybe used a company that can, link you to a trusted provider to come and clear your walkways and driveways during the winter seasons. The snow removal program, Snow Angels, that's a volunteer organization, is located in some areas. They're not everywhere, but that's something to look into as well online to see if they offer services where you live. The town of Oakville and also the city of Mississauga will come to remove the windrow at the bottom of your driveway. So this is that large bank of snow that gets built up after the plow goes by, and that can be extremely difficult to remove. So if you are a senior over 65 and you don't have anybody who is younger or capable living at that address that may be able to help you, you'll be eligible for this program. It's available from December 1st to March 31st. The last cost I had on that was $115 in Oakville. Mississauga has a similar program. It's $200, but it may be free for residents that meet certain financial criteria. Right, so two things to look into. Putting things like sand or ice melt on the walks as well for traction can be helpful to make the area a little bit safer. Another thing to think about in the winter besides the snow and ice is also our amount of daylight. Remember, it gets darker, and that can make it more difficult to see, earlier in the evening. So if that's a challenge for you, trying to plan going out and coming home sort of before 5 o'clock is helpful. Another puzzle piece was sort of those hazards in the home when we think about risk factors. There are multiple things that people may choose to have in the home or ways they decide to outfit their home that can increase the hazard or risk or fall risk. Things like electrical cords or wires that are running along walkways or high traffic areas, clutter, carpets, right? Poor lighting. So anyone will struggle to see in low lighting, but especially people whose eyesight is already diminished. This will become more of a risk for them. Stairs and steps. Okay, many of homes in North America are built with stairs and steps. Are they in good condition? Is there a handrail on both sides of the stairs? Is it a good sized handrail that your hand can go all the way around and get a really good grip? All right, those are some things that can help with getting someone up and down the stairs when mobility starts to become a little bit more of a challenge. One thing to do is to sort of make sure that all of those areas are sort of clear and things are in good repair. So as I mentioned, making sure that stairs are, they're not uneven or worn, making sure that there are no loose carpets. These are big risk. Even if they have really good backing, they may fold up and they're easy to trip over. Making sure light bulbs are replaced when they're burnt out or they're of a high enough wattage that people are able to see. Using a home safety checklist to review hazards can be helpful as well. If you're not sure where to start looking in your home, a safety checklist is a really good resource, and can outline, how to check your home for hazards and provide tips on, how to make the home safer. One good one is the Staying on Your Feet home safety checklist. This is an example of how modifications in the home can help, to sort of adjust to mobility changes. So this is a bathroom that has undergone some alterations to make the space safer and perhaps afford the user some increased independence with personal care. So the toilet seat is raised. Okay, a really low toilet seat can make it difficult for the person to get on and certainly off. So if we raise it a little bit, okay, it makes it easier for them to certainly to stand up. Grab bars on the tub of the walls, right? It's easy to get someone to install those. Adding a bath chair or a bench, and a handheld shower head allows for a little bit more control as well. So someone could sit on the bench, okay? They could shower themselves with the handheld shower, and then they can use those grab bars to maneuver. Okay, it's all about safety and also in this instance, independence. Having these supports in the bathroom can also help that person be able to perform their own personal care for longer. Having some, it's not visible here, but having some of those stickers in the bathtub, on the surface of the bathtub, can also help with grip. Okay. Some people will use tub mats. These can be very dangerous and actually increase the risk of an accident, as if they are not properly um, pressed down and adhered to the base of the tub, they can actually sort of float on the water, and it's not necessarily so obvious that they're not stuck down, and someone can sort of step on it and they will really take a terrible tumble. So those little bathtub stickers, okay, or strips are a better option. Some other small sort of changes that can be made to help prevent falls around the home include making sure that regularly used items are within reach. So things like eyeglasses, the remote control, if someone needs their walker or cane to get up, okay, or any other kinds of aids, having their phone nearby. I wouldn't suggest that they reduce physical activity, but if they have to get up and down constantly and move around, that might be something that will increase their risk of falls. So what can we do to sort of keep things nearby, so that we, we reduce sort of those opportunities for falls? Taking your time and staying focused. So giving full attention to what is going on, making enough time for things to be done as well. Sometimes when we have personal care to be done or baths or showers to be done, we start to rush, all right? This can increase fall risk as well, or an injury, okay? That includes when, having time to take our time to change positions. So when walking or getting up, don't rush. We know that oftentimes when we stand up really quickly, our blood pressure takes a little bit of time to adjust. So that can cause dizziness and can lead to falls. So again, having that time to pace ourselves through tasks is important. And having a plan in place in case the person you're caring for is alone is important as well. So how can we be prepared? They may need to have a personal alarm that will reach out if they fall. Sometimes people can wear something around their neck that they can pull, or it gives a signal that the individual has fallen. Is there someone that can check in daily and give a call so they can expect a call every day, maybe at 11 and a call at 4? And if no one answers, maybe that raises some red flags. Wearing or carrying a whistle. So this can be helpful as well for someone when they're alone, particularly if they live in a condo or an apartment where there's others around. Blowing that whistle may help to get someone's attention. It's all about being prepared. So despite putting all of these ideas in place, a fall may still occur. So let's review some options and for help and management that can help support us in the unfortunate event that a fall happens. So if your care partner has a fall, the response may differ based on the seriousness and level of injury that has taken place. For sure, if the person is unconscious and or if there's obvious injury, call 911. There's no question there. If they're not seriously injured and they're conscious and alert, but they're unable to get up on their own or with assistance, 911 is still the appropriate option. It may be impossible for you, even though it might seem reasonable, for you to lift the person off the floor based on their limitations or your own physical abilities. You may both end up injured. The right option here is to call for assistance by calling 911. Once you call, the operator will triage and assess the call, and EMS will come to provide assistance. In addition to helping them get up safely, they can also perform an assessment there at the home and decide on any treatment and or whether the person may need to go to the emergency room. There may be a wait for them to reach you, so try your best to keep your care partner as comfortable as they can where they are and monitor them for any changes in status while you wait for the paramedics to arrive. If they fall and between the two of you, you feel you can assist them up, okay? These are 4 steps that you can use. So first of all, I want you to resist the urge to immediately help them. Again, thinking about their condition, their level of consciousness. Are they conscious at all? Is there any blood or any obvious injury? Do they have pain? Again, I reiterate, you need to call 911. If they seem able to get up with your help and you both have the physical capability to do this, okay, you can start by bringing a chair close by. Help the person turn onto one side, all right, and bend that upper leg, right? Help them up into a semi-seated position, okay? Bring that chair close, stand in behind them, okay? And getting a firm grip on their hips, help the person get into a kneeling position with both hands on the chair, okay? They can hold the chair and they place that stronger leg in front, and you can help by guiding their leg. Right? And then you can further help them to stand from there, and then they can turn and sit on the chair. So this is going to be something that can be done probably in a small amount of cases, all right? I would encourage you to get help if there's someone in the home that can help you get them up, and they're able to, again, assist both of you, and there's no obvious injury, that's a good option as well, okay? This ability to sort of get themselves up will depend on many of the circumstances, and I reiterate, when in doubt, 911 is your best option. I want to talk about some falls prevention programs that are another important step in reducing the chances of a fall at home. Programming here focuses on providing guided physical activity structured for individuals at a number of different fitness levels, as well as education and steps on how to reduce fall risk. Credit Valley Hospitals has a falls prevention and bone health program. Okay, this is run in Toronto, Mississauga, and also in Halton at the Oakville Trafalgar Memorial Hospital. They offer an assessment at their falls prevention clinic, participation in the strong and steady exercise program if the individual is physically able, and they will also do a follow-up call after the program is completed. A physician referral is required for this as well. The VON offers a smart exercise program and falls prevention classes. So This offers low, moderate, and high mobility classes and are ideal for clients who have difficulty taking part in traditional exercise classes due to changes in their physical health, mobility, or their health conditions. The classes help improve strength and balance at any fitness level. So this is for adults 55 years or older, and or with a disability. They can be delivered in the community, in retirement homes, and also there are virtual options. Okay. What's great about this is that it's free and also no physician referral is required. You can reach out to your local VON and find out what programs are available where you live. Okay, so the Credit Valley Hospital Falls Prevention and Bone Health Program, more in again offered in that Toronto, Mississauga, Halton region, and the VON option is widespread throughout Ontario. All right, so thinking about which is best for you based on your location. LifeMark Seniors Wellness offers a number of free exercise programs and also falls prevention programming for seniors, adults with disabilities, and also individuals that are diagnosed with chronic illness. So if you visit their website, or call or give them a call, you can find out more and sign up. Lots of different options here. So falls prevention running throughout the year, a lot of general exercise programs, just to keep people fit and healthy. Again, improving strength and balance, which we know helps our end goal in terms of reducing fall risk. Also, some things there for those of us struggling with osteoporosis. Some final thoughts in closing. So remember, anyone can fall, but as we age, the risk increases due to many factors, including having a medical condition. The good news is that falls are not a normal part of aging, and in fact, many falls are preventable if we identify the risks and modify what we can. Again, it's looking at those near falls and seeing where we can make some changes. Again, think about having a plan in place if the person you're caring for stays for long periods of time alone or lives alone. What can they do to call for help? May need to get creative in this area. Always let your healthcare provider know if a fall has occurred, or again, even a near fall. This can help to address those issues and prevent a future fall from happening. I hope that this information will help to increase your ability and reduce the risk of falls and manage them at home in the event that one occurs. Thank you for visiting our YouTube channel. If you're looking for more caregiver education, please feel free to reach out to us. To find out more about our programming, visit our website at theregionallearningcentre.ca and click on the Family Caregiver Hub. There you will find our calendar of upcoming events, a list of trusted caregiver resources, and a link to subscribe to our emailing list. You can also email us at info@regionallearningcentre.ca. Thank you for joining us.